Welcome students. Today I am going to discuss about calcium regulating hormone. Calcium regulating hormone are the part of endocrine system of unit 4 of Human Anatomy and Physiology 2 and the subject code is BP 201T. In the previous lectures, we have already discussed basic introduction of the endocrine system, hormones, their classification, their general mechanism, and we have already discussed hypothalamic, pituitary hormones and thyroid hormones. In this lecture, we will discuss which are the hormones which are responsible for the regulation of the calcium, that is which are important for the maintenance of calcium homeostasis in our body. Apart from this, we will also discuss the thyroid gland disorders, that we have thyroid hormones we have already covered. Here we will discuss their disorders and calcium regulating hormones. So, basically there are the two hormones, calcitonin and parathyroid hormone. These are the calcium regulating hormones. So, first is calcitonin. So, calcitonin is a calcium regulating hormone which is produced by the parafollicular cells of thyroid gland. Thyroid gland location we have already covered, that is present anterior to the trachea, inferior to the larynx. Thyroid gland, and in the thyroid gland there are the two type of the cells, follicular cells and parafollicular cells. Follicular cells secrete thyroid hormone T3 and T4, and few parafollicular cells that are present between the follicular cells, they secrete calcitonin. So, parafollicular cells. So, parafollicular cells, they secrete calcitonin. So, just a second. So, parafollicular cells of the thyroid gland, they secrete calcitonin. Parafollicular cells or C cells lie between the follicles of the thyroid gland, as I have told you, and it is hypocalcemic hormone, that is it decreases the level of the calcium in blood. Hypo means decrease, calcemia and emic comes for the blood. So, hormone that causes the decrease in the level of calcium in the blood. In the blood, it decreases the calcium level. So, it is known as hypocalcemic hormone. So, calcitonin is a hypocalcemic hormone, and how it decreases the level of calcium? It decreases the level of calcium by inhibiting the action of osteoclast, by inhibiting the action of osteoclast. Osteoclasts are the cells that are responsible for the resorption for the bones, the resorption of the bony matrix, that is they causes the breakdown of extracellular matrix of bones. Because of the breakdown of the extracellular matrix of bone, calcium will release and come into the blood, but calcitonin wants to reduce the blood calcium level. So, it will stop the action of osteoclast, so that no more breakage of the extracellular matrix of the bone, no more release of the calcium into the blood. We will discuss it detail in the next slide. So, calcitonin is a calcium regulating hormone produced by the parafollicular cells of the thyroid gland, parafollicular cells of the thyroid gland, and it decreases the level of the calcium in the blood. Miacalcin is a calcitonin extract. Miacalcin is a calcitonin extract that is obtained from the salmon fish. It is 10 times more potent than human calcitonin and it is used to treat osteoporosis. Miacalcin is more potent than human calcitonin and miacalcin is obtained from the salmon fish and it is used to treat osteoporosis. Now, how the action of calcitonin is regulated and what are the actions of calcitonin. So, secretion of calcitonin is controlled by negative feedback system. By negative feedback system, and who controls it? Calcium itself. Level of calcium itself controls the secretion of calcium. If there is high level of calcium in the blood, when there is high blood calcium level, it will stimulate the secretion of calcitonin, while low blood calcium level will inhibit the secretion of calcitonin. So, because calcitonin is a hypocalcemic hormone, that is it decreases the blood calcium level. So, whenever there is the high blood calcium, it will stimulate the secretion of calcitonin, so that blood calcium level can be reduced by calcitonin. Now, how does it reduces the calcium level in blood? So, please remember, it will reduce calcium in blood. So, to reduce calcium in blood as well as it reduces the concentration of phosphate, it will inhibit bone resorption. It will inhibit bone resorption. So, bone resorption is performed by osteoclast cell. Bone resorption is performed by osteoblast cell. So, it will inhibit. So, first action is inhibition of the bone resorption by the osteoclast. So, osteoclast cells are the cells that break down bone extracellular matrix. As we all know, bone extracellular matrix consists of calcium phosphate, calcium carbonate. So, as soon as bony matrix will break, calcium will be released from the bone matrix to the blood. So, calcium level will rise in the blood and that we do not want. There is already increase in the blood calcium level. So, increase in blood calcium level releases calcitonin. Calcitonin will stop osteoclast activity, so that no bone resorption occur. It will inhibit bone resorption, so that there will be no breakage of extracellular matrix and no release of calcium into the blood. Second action, it will also uptake, it will enhance, it will accelerate the uptake of calcium and phosphate into bone extracellular matrix. It will accelerate uptake of calcium and phosphate from the blood. It will take the extra calcium, it will take the extra phosphate and it will take from the blood to the bone extracellular matrix. So, one thing, it is reduces breakdown of the extracellular matrix. Second thing, it is taking up the extra calcium and phosphate from the blood to the extracellular matrix, thus it reduces blood calcium level. So, this is the action of calcitonin to reduce blood calcium level. Second hormone that regulates blood calcium level is parathyroid hormone, but action of the parathyroid hormone is exactly opposite to calcitonin hormone. Calcitonin hormone decreases blood calcium level, but parathyroid hormone increases blood calcium level. So, parathyroid hormone is major regulator of the level of calcium, magnesium and phosphate ion in the blood. It is produced from the chief cells of the parathyroid gland. And where does parathyroid glands are located? Parathyroid glands are 4 small round masses of the tissues that are located, that are present in the posterior surface of thyroid gland, thyroid gland के पीछे. So, this is the thyroid gland, this is the posterior side of the thyroid gland, and these 4. So, these 4 small round masses are the parathyroid gland, which are present on the posterior surface of thyroid gland. So, these 4 small round masses of the tissues embedded in the posterior surface of the thyroid gland are parathyroid gland, and parathyroid glands, they causes the increase in blood calcium level, and these are the produced from the chief cells of the parathyroid gland. So, going further, parathyroid gland, parathyroid hormone increases blood calcium level. How? It increases the number and activity of osteoclast. As I told you, parathyroid hormone is exactly opposite to calcitonin. So, parathyroid hormone increases the number and activity of osteoclast, while calcitonin inhibit the action of osteoclast. So, when it will increase the activity of the osteoclast, more breakage of the extracellular matrix will occur, more of the calcium will release from the bony matrix and will go into the blood, and in the blood calcium level will rise. So, it increases the bone resorption by osteoclast, which releases calcium and phosphate ions into the blood. Calcium, it also increases calcium reabsorption, that is calcium will go into the blood, and phosphate excretion by the kidney. And its third action is it will promote the formation of calcitriol. Calcitriol is active form of vitamin D, and this calcitriol increases the intestinal absorption of calcium and magnesium. So, these are the actions of parathyroid hormone which increases blood calcium level. So, 2 hormone, calcitonin, parathyroid hormones are the calcium regulating hormone. This will be more clear with the help of this flow diagram. So, as I told you, who is the regulator of their secretion? Calcium. The blood calcium level directly controls the secretion of both calcitonin and parathyroid hormone via negative feedback mechanism. So, how? So, this flow diagram shows the regulation of secretion of calcitonin and parathyroid hormone and how do they produce their action. So, first thing you have to remember, calcitonin decreases blood calcium level and parathormone increases blood calcium level. This you have to remember. So, and who is the regulator? Calcium. Who is the regulator? Calcium. So, as soon as whenever there is increase in level of the calcium in the blood, it will stimulate thyroid glands parafollicular cells. Parafollicular cells of the thyroid glands get stimulated when there is high level of the calcium. So, high level of the calcium in blood will stimulate the thyroid gland parafollicular cells to release calcitonin. So, parafollicular cells will release calcitonin, and calcitonin will inhibit osteoclast and thus decreases blood calcium level. So, calcitonin का क्या काम है? ब्लड में कैल्शियम को कम करना by inhibiting osteoclast. And as soon as blood calcium level falls, so low level of the calcium, whenever there is low level of the calcium, it will stimulate the parathyroid gland. It will stimulate the parathyroid gland chief cells to release parath hormone. So, this parathyroid hormone, it will promote the release of calcium from the bone excess cellular matrix, that will it increase the bone resorption, breakdown, it will increase the breakdown of bone, more of the calcium will go into the blood, and thus it will slow the loss of calcium also from the urine. Thus, it will increase blood calcium level. Parathyroid hormone also stimulates kidney to release calcitriol. Calcitriol is active form of vitamin D. This calcitriol increases the absorption of calcium from the food, and thus increases blood calcium level. So, by the three action, parathyroid, once it promotes bone resorption, second it reduces loss of the calcium from the kidney, third it stimulates the calcitriol. So, calcitriol increases the intestinal absorption of whatever we take from the diet, that from that diet calcium is only absorbed in the presence of vitamin D. So, vitamin D active form is calcitriol, it will stimulate the absorption of calcium from the food, thus it increases blood calcium level. And whenever there is excess of calcium in blood, then again calcitonin will release and reduce the blood calcium level. So, this is how calcium ions regulate release of calcitonin and parathyroid hormone, calcitonin and parathyroid hormone. So, this was the regulation. Now, we will discuss the thyroid gland disorders and parathyroid gland disorders. Thyroid gland disorders, whenever there is large amount of thyroid hormone is present, then it is known as hyperthyroidism. When there is a low thyroid hormone, then it is known as hypothyroidism. Hyperthyroidisms are grave disease, multinodular goiter, thyroid storm. These are the few disorders characterized by hyperthyroidism. Hashimoto's thyroiditis, cretinism, myxedema, these are the disorders which are characterized by hypothyroidism, that is reduced thyroid level. This is hypothyroidism. Earlier it is we call it cretinism, nowadays we call as congenital hypothyroidism, that is whenever there is severe deficiency of the thyroid hormone in newborns. So, in the presence of the deficiency of the thyroid hormone, it will cause impaired neurological function, stunted growth and physical deformities, and it may occur because of the problem with baby's thyroid gland or a lack of iodine in the mother's body during the pregnancy. So, in congenital hypothyroidism, baby will be with the stunted growth and mentally retarded in the absence of thyroid hormone. Myxedema, it is also example of hypothyroidism, but in the adults, when there is accumulation of hydrophilic mucopolysaccharides in the skin and other tissues. It is more common in the women. Myxedema is uncommon but life threatening. It occurs in the patient with long standing hypothyroidism. It is precipitated by climate induced hypothermia, infection, drug therapy and other systemic conditions. What are the symptoms and signs of myxedema, weakness, lethargy, confusion, feeling cold, low body temperature, hypothermia. In the absence of thyroid hormone, we feel more cold, swelling of body, especially the face, tongue and lower legs, difficulty in breathing, fluid buildup around the lungs and the heart, slow heart rate, seizures, hallucinations, reduced function of the digestive system. Hashimoto thyroiditis is also known as chronic lymphocytic thyroiditis, an autoimmune disease in which the thyroid gland is gradually destroyed. Over time, the thyroid may enlarge, form a painless goiter with accompanying weight gain, fatigue, constipation, depression, hair loss and the general pains. Grave disease is example of hyperthyroidism, autoimmune disorder in which person produces antibodies against TSH. So, antibodies stimulate the thyroid gland to grow and produce thyroid hormones, result in the enlarged thyroid gland and protruding eyes, which is special feature exophthalmos of the grave disease. Sign and symptom of grave diseases are anxiety, irritability, tremors, heat sensitivity, warm and moist skin, weight loss, enlargement of the thyroid gland, goiter, bulging eyes, thick red skin, irregular heartbeat, frequent bowel movement, sleep disturbance and fatigue. Multinodular goiter is hyperthyroidism in which multiple nodules are present, and it can be because of the iodine deficiency, genetic factor, and if the thyroid gland is not making enough thyroid hormone, pituitary gland in the brain will release more of the TSH, and excess TSH can cause thyroid to enlarge and it will create a multinodular goiter. So, those were the thyroid gland disorders. Next is the parathyroid gland disorder. Low parathyroid hormone leads to deficiency of blood calcium level known as hypothyroidism, and high level of the parathyroid hormone causes excessive resorption of bone matrix, raising the blood level of the calcium and phosphate ion, causing the bone to become soft and easily fractured, and that causes hyperparathyroidism. So, this was parathyroid gland disorders, hypo as well as hyperparathyroidism. So, these are the references for the further reading. So, thus we have completed calcium regulating hormone, mainly calcitonin and parathyroid hormone. Thank you.